In 4 days, the country's public hospitals could go silent again. This is not the first time this year. But the Nigerian Association of Resident Doctors has given the federal government until 8 a.m. on Monday, which is the 10th of August, 2026, to meet its demands or face what NARD is calling a total comprehensive industrial strike nationwide, indefinite too. Now, this isn't a fresh grievance. NARD, which is the National Association of Resident Doctors, had already extended an earlier 21-day ultimatum by 4 weeks back in June, warning it could move to industrial action if issues weren't substantially addressed. That window closes on Monday. Now, at the heart of it, unpaid areas of the 25 to 35% CONMES salary review, 19 months of unpaid professional allowance, delayed promotion arrears, and eligible doctors still shut out of the 2026 Medical Residency Training Fund. Now, there's also an unresolved crisis at Lagos University Teaching Hospital, where NAD accuses management of intimidating resident doctors and refusing to provide call duty meals for doctors working shifts that can run well beyond 24 hours. And a separate dispute at OAU Teaching Hospital in Ile-Ife over attempt to reintroduce bench fees despite existing government directive. Now, to be fair, government NAD itself has credited some progress. The 2026 Residency Training Fund reaching most eligible doctors and welfare improvement in states like Osun, Kaduna, Oyo, Rivers, and Plateau. But nationally, Nigeria is still down to roughly one doctor to about 3,600 to 4,000 people, after more than 16,000 doctors emigrated in just the last 5 years. So this morning, we're going to be asking some very critical questions. What exactly has gone unpaid? Why does implementation keep stalling their agreement after agreements are signed? And what happens to patients on August 10th if nothing changes? And joining us is Dr. Abdul Majid Yahaya Ibrahim. He is the Publicity Secretary and Social Secretary of NAD. Good morning. Good morning, sir.
Good morning to you, and good morning to all our listeners and viewers.
It's good to have you join us.
Thank you very much.
All right. So I'll just take lead from the very last statement I made from the introduction. Why are these payments not still being made? And why do we have agreements signed and it is not being met up to? It's not just for NAD now. I think ASU is the same crisis we're facing with ASU. Same scenario. So talk to us about it.
Well, thank you very much. Before I respond to that question, let me just make a reference or a little correction to what you've said, that the Nigerian Association of Resident Doctors have given a 21-day window period, but it goes beyond that. If you can remember, last year, we suspended our total indefinite strike on the 29th of November. We give a 4 weeks window period, after which we still extended. In fact, I can tell you for free that we've extended the ultimatum for more than 4 times.
Okay.
And we thought, out of goodwill and sincerity and commitment from the government, they will respond to all these demands so that at least everybody will be at home, everybody will be at peace, and there will be harmony in the health sector. But unfortunately, these issues have not been addressed, and then other issues are also coming up which needed the government to actually take action. And it is because of all these delays, the lack of commitment from the government, that made the National Executive Council of the Nigerian Association of Resident Doctors to make this bold decision to embark on a total shutdown commencing on 8 a.m. 10th of August. If you look at it from the very day we had this meeting that we issued this declaration, the government have more than 10 days for them to actually address this issue. So why it is not being addressed, I think it is the government that will respond to this, because they are the actors, they are the ones that are meant to address some of these issues, which I believe we'll discuss them in the course of our interview.
All right.
So right now, the threat for the nationwide strike, is it a strategy? Is it a bargaining tool, rather, to push the government into action?
Well, to some extent, because if you look at it, one thing what I want the public to know is that it's not as if doctors are interested in any strike. It is not in our culture, but the only thing we've written several times, we've had a lot of advocacy, but they are not yielding effective results. All of our members want a palpable results. So it is because of this that the National Executive Council decided to embark on this shutdown. Probably that will be the only tool that will actually push the government to address all these issues. They
Okay.
still have some ways if they can actually do what is expected to avert this total shutdown.
Okay. Please, can you break down the figures for us? Because there are lots of allowances that are yet to be paid. How much in total is currently owed in commerce areas and professional allowance areas? And since when has the government known of these figures?
All right. Let me before I go into the areas. Let me discuss some of the key issues of concern to us.
All
The
right.
issue of our house that's uh, who are house officers who are the first contacts in the hospitals. They are the most junior professionals in the health sector as far as doctors are concerned.
Mm-hmm.
It is so unfortunate that this group of young doctors who have a lot of responsibility are not being paid their salaries as at when due.
Okay.
For instance, now today is 4th August.
Yeah.
Hmm? Their June salary was paid in the third week of July, and that has been a tradition.
Oh, okay.
Some of them have arrears ranging from 3 months to 9 months, and this is just a 12-month period uh, housemanship that I meant to spend. Why are we having all these challenges? Why can't their payment, their salary be regularized so that they can receive their salaries as at when due? Why can't arrears be paid? Why can't they be on a platform that will ensure regularity in the payment of their salaries? They are human beings. You can't expect someone to be working with the excess workload and so many other factors, and you still deny him his own salary for the work he has offered. This is one of the key issues of concern to us. Then the second issue is the issue of assault.
Okay.
It is so unfortunate that hospitals that are meant to be a very safe atmosphere for both the healthcare workers as well as patients and their relatives, but it's no longer safe now. Rather than appreciating what healthcare workers are doing, uh, patients and their relatives have now resorted toward assaulting our members, assaulting healthcare workers. I can tell you in the last 1 year, we've recorded almost 30 cases of assault to both doctors and other healthcare workers. And out of these 30, I don't think we've had up to five or more than five that an arrest was made and the assailants were prosecuted. The last one that happened, it happened, I think, last week at FMC. After assaulting the doctor, they stripped this doctor naked. They were able to put him inside their car boot and go out with him. Who does that, for God's sake? What do we, can't we deserve a simple respect from the public? And then all what we're requesting is for government to have a policy that will actually criminalize the act and that will come up with some punitive measures that will serve as a deterrent to all the accidents. And then for all the cases at hand, they should be addressed, they should be treated.
Okay.
All the accidents should actually be so that at least that will serve as a deterrent to others.
Okay.
But because
Be-
nothing is being done,
okay.
everybody is doing whatever he wants.
All right.
Then moving on.
Before you go to the question of how much is being owed in general, you spoke about this policy of assault. But I know that some hospitals come up with these policies themselves. So do you think that this is entirely the responsibility of the government? Because I know certain hospitals you walk into now, you see the policies boldly written at the reception. If you assault any doctor, you'll be arrested and prosecuted. Do you think this is entirely the responsibility of the government?
Yes, this is entirely the responsibility of the government because who does the prosecution? And
Okay.
then is how many of these hospitals have this policy? Why can't we have a national policy that
Okay.
will be adopted or be adopted by all hospitals? This is what we're requesting.
Okay. Okay. Let's go on to the amount.
The areas now.
All right.
Yes.
So areas. Let me start with salary areas. We have centers like Federal University Teaching Hospital Otupo, FMC Owo,
Okay.
Wafemi Awolowo University Complex, University of Eyo, and so many other hospitals that have backlog of salaries. And the whole sum of this salary is not up to 500 million. I don't know why it's taking longer than necessary for the government to settle these outstanding salary areas. That is on that part.
Okay.
Then for promotion areas, to make our officers, the whole sum of it is 8 point something billion. It's not up to 9 billion. This has also not been paid for the past 5 years. Then moving on to the issue of the professional allowance areas. Let me make a preamble here. You see, this correction of this consequential adjustment of our salary is what to have been done since 2019, but this was not done until last year, November, meaning we are expected to receive areas of 7 years. But the government, federal government decided in their own way to give 18 months areas. That is what was stated clearly in that circular. Nobody uh, frowned at it, and they were all accepted that wholeheartedly and out of goodwill. And it was stated clearly in that circular that uh, the areas will be captured in the 2026 budget and it will be paid as soon as the budget is passed. But as it is now, nobody is talking about the issue of the areas. And these areas is for all the healthcare workers, not doctors only.
Mm.
And it's about 230 something billion.
Okay.
So I really don't know what is really happening.
Mm.
Uh, in fact, for the fact that we even accepted to have agreed to accept 18-month arrears out of 7 years, I think this is something that the government should actually
7 years.
consider to
Okay.
follow exactly. They should also do their own due diligence by
Mm-hmm.
honoring the goodwill that we're
Of
showing.
doctors. But doctor, let's take you back to January this year, where we saw that the Federal Ministry of Health said that the number of unresolved demands, had reduced from 19 to 9, and also pointed to an additional 90 billion naira annually rather, for health workers allowances as evidence of government commitment, right? But of course, NARD have said that the situation remains unacceptable. What is the disconnect between the government position and your experience on the ground?
You see, well, I can say that at least we're happy that some of these demands have been addressed.
Mm.
Even from our discussion, I only hammered on 6 issues. Although I have not discussed the issue of LUTS, that's the Lagos University Teaching Hospital,
Yeah.
Mm-hmm.
where members are their basic rights of their basic rights. That's a whole meal,
Mm.
which has been a tradition for a very long time. There is no way someone will be on call, someone will cover all patients that will come during emergency or outside working hours, and you will deny that person a food that he will eat. After all, what is being given in most of the hospitals is not that palatable, but we'll still accept that.
Mm.
They are now expecting people to leave their duty post, go home, either cook and come back to work, or they go leave the hospital and go to any restaurant, eat and come back to their duty post while they are on call.
Mm.
What happened to emergencies that will come around that time? And because our members have agitated, they have cried out, they have been victimized, they have been denied to go for the professional exams. These are some of the crises at Lagos University Teaching Hospital.
Yeah.
So going back to the question that you asked, at least we can say that some issues have been addressed and then some are yet to be addressed, or
Mm.
some at least effort has been made.
Mm.
For instance, the issue of this professional allowance, we are happy that at least the correction has been made
Mm.
and it has been implemented. What remains now is the issue of um, the areas.
Okay.
Then we also have other outstanding issues that committee were set up, but up to now, we're still waiting for the final recommendation and implementation of the reports of those committees. For instance, the issue of um, call duty, call hour regulation, issue of casualization of doctors, the issue of membership categorization, all these things, issues, we're waiting for the final implementation of the recommendations of the committee that was set up by the Federal Ministry of Health.
Okay.
Then there are other issues like the bottlenecks in the issue of the skipping areas. Of course, all these things have also been addressed. and the rest. So we can say that at least there is an effort, some commitment from the federal government to address some of the demands, but we still have other outstanding issues that have not been addressed.
What,
And
what
this is what's is causing the agitation from our members.
okay. What are your non-negotiables right now? What is one of the demands, or two basically, that must be met by the government for the strike not to happen?
If you look at it now, the six issues I've mentioned,
Okay.
I don't think they're difficult things for the government to address.
Mm.
The issue of local crisis, we actually want, just like what's happened in the case of IFE, the Federal Ministry of Health summoned the Chief Medical Director together with the leadership of the association, and all the issues were resolved.
Mm.
Why can't this be done with respect to the issue of loot? Why can't the Minister of Health invite the Chief Medical Director, the leadership of the Association of Resident Doctors in that center for a roundtable discussion so that these issues can be addressed once and for all?
Mm.
Then the issue of house officers, why can't they be on a platform that will ensure payment of their salaries as at when due? Why can't their areas be paid? These are what we're demanding. Then for promotion areas, salary areas, these are things that have been lingering for a very long time. Why can't all these things be paid? And then for the part areas, of course, we know that it is difficult for the government to pay the whole sum of that money at a go. But can we have a payment plan? Can they give us the modalities of payment, even if it is instrumentally, just the way the 25% commerce areas was paid? At least I don't think this will be a difficult thing for the government to offer, and then it will not be a difficult thing for the entire health workers to accept that once there is commitment and once there is sincerity from the government side.
All right, Dr. Yahya, you also made mention of workload and very tedious schedules for some of these doctors. And according to the Nigerian Medical and Dental Council, they say that they have registered over 130,000 doctors, but only 55,000 are in Nigeria, practicing Nigeria, which explains why the ratio of doctor to patient is quite alarming. In fact, way, way, way above what the WHO had planned. And according to these same statistics I'm looking at here, living a doctor to patient ratio here in Nigeria is 1 to 3,600 to 4,000, which of course sounds like a lot for one person to handle. From your opinion, what are the policies that you think that the government can implement when it comes to the welfare and the rights of these doctors? Because I believe that if the government adjusts in certain areas, then the doctors would be convinced enough that the country cares about them, might stay behind to look after patients here in Nigeria. But what do you think the government can do realistically to help salvage this situation?
Well, thank you very much for this question. If you look at it based on the statistics that you mentioned, I can tell you for free, we don't have up to that 50,000 or 55,000 doctors that are practicing in Nigeria.
Really?
Yes, because
Wow.
even our number, the resident doctors,
Mm-hmm.
we actually form almost 45 to 50% of the workforce in the health sector as far as doctors are concerned. And we are not more than 12,000 in the entire country.
Wow.
10 years back, we are up,
12,000.
we're more than 5,000. So what is really happening? Every day, Nigeria is producing quite a number of doctors.
Yeah.
If you check on, yeah, quite a number of doctors have medical students have graduated. They have had their own induction. But why is it that this number of doctors are not being retained or are not staying back to work in the country?
Mm.
It all goes down to the issue of what remuneration, the issue of having a very safe environment, having a regulated uh, working working hours and on other things that will actually attract those group of doctors.
Yeah.
And these are issues that have been driving some of the doctors or and other healthcare workers to leave the country to seek for greener pasture.
Pastures.
There is an ongoing discussion on collective bargaining agreement (CBA), which is like a platform that provides or that allows all the unions, the health unions, to come together and present what they feel the government can actually offer that will improve their own setting. This committee is being headed by the Minister of Labor. All
Okay.
the health unions have had oral meetings. They have submitted their requests and their reports to the Minister of Labor. We're now awaiting for the federal government to have a look at those demands and then see what they can offer. By the time at least the federal government do their diligence to, uh, increase the salary of all the healthcare workers, commensurate with the inflation and other things, I believe quite a lot of people will love to stay back and work for the country.
Mm.
Once you have a very safe environment, the issue of assault are being addressed, you have what it takes to work in the hospital. That's I'm talking about infrastructure, equipment, and the rest. Nobody will leave the country.
Hmm.
Wow.
Because if
Okay.
you look at
Sorry,
driving
just
people,
okay. Go on.
what is driving people out of the country is what the welfare packages.
Mm.
Okay. So that's what I
Especially the
wanted to
welfare
ask
packages.
of. Yes.
Yeah.
Exactly.
What does a proper welfare for a doctor in Nigeria? What should it look like? We're talking about figures now.
Mm.
Well, to be fair, we can't say that the federal government should pay exactly what countries like UK, US, Asian countries are paying.
Mm.
But at least, is there anything they can do? Why can't they look at how? In fact, let me give you, for instance, now when I did my housemanship,
Okay.
my salary was almost $1,000 as of that time.
Mm.
But now, even a senior professor in the profession is not receiving up to $1,000. So tell me, what really happened?
Mm.
How can we address this issue? I believe the government can do better by looking at the welfare packages, how to improve on the salary structures of all health workers, how to make these hospitals very safe for doctors to perform to work without having any fear that they will be assaulted,
Okay.
and then they should all provisions for all the necessary equipment that each specialist will actually perform his duties
Okay.
efficiently.
Well, doctor, you mentioned earlier that we have less than 12,000 doctors across Nigeria. Now, help us understand
That's
this. The
resident doctors.
resident
Resident
doctors
doctors.
across Nigeria. Help us understand what the shortage looks like, inside a teaching hospital. Now, on a normal shift, how many patients could one resident doctor be responsible for, and what does that mean for patient safety as well?
Well, if you look at this figure, and I look at our population, depending on for instance, my own hospital, for instance,
Mm.
we don't have more than 400 resident doctors. This is a hospital that is the largest in the whole of Northeast.
Mm.
We see patients not just from the northeastern states, but countries like Cameroon, Chad, Central Africa. Patients still come down to our hospital. If you look at these statistics some years back, let's say 10 years back, the number of resident doctors was more than 25,000.
Mm.
Juxtapose that to the Nigerian population, look at what is our current population now, and then what is the number now. What do you think would be the ratio? It means that if, for instance, one doctor was seeing, uh, let's say 1,000 patients in some years back, it means that doctor now, a doctor is seeing more than 5,000, for instance, because the population has increased, the workload has also increased because of the manpower shortage.
Mm.
And all these things are some of the factors or some of the things that are driving our people away from the country because they feel they can't actually cope with the burnout.
Mm.
People are dying from burnout. People are coming down with a lot of comorbidities because of this burnout. And then nobody cares or even appreciates the excess workload that healthcare workers generally
Mm.
are doing.
And that's a big concern. And trust us, doctor, we worry about this situation as well. But if you also look at the situation, the challenges going on in the country, Nigeria, every time doctors go on strike, the patients in the hospitals are the ones that are going to bear the brunt of this particular situation.
Absolutely.
My question to you is this: is there no other way that doctors can engage the government? I mean, have you exceeded every dialogue option, before heading to strike? Because again, patients who can't afford private hospitals, depend on the public hospitals, and that's what most of the resident doctors are.
Thank you so much for this question. I want you to know that Anytime you see doctors or healthcare workers embarking on a strike, they must have exhausted all the possible pathways, all the channels that needed to be discussed, all the people that needed to be discussed, and then nothing is actually coming out from them. Most of the times, or it has been a tradition that we always engage, we always write officially
Mm,
to our parent ministry, the Ministry of Labor, and any other relevant authority that needed to act to address some of these issues.
mm,
We do quite a number of advocacy. Sometimes we go our own way to even involve other influential individuals that we feel can actually help in pressing some of our demands. But at the end of the day, nothing will actually be gotten from such advocacy and other engagement. And we have no other option than to resort towards a strike.
Hmm.
It's not as if we enjoy embarking on that strike, but we feel probably that's the only thing that will draw the attention of the government and that also draw the attention of the public so that at least the entire Nigerians will also support the doctors in drawing the attention of the government to address these demands. And I've said we still have some days. I believe the government can actually do what their own diligence. We're very open to discussions. We're very open to negotiations. But what is much important is what sincerity, because we've had several uh, agreements, several MOUs,
mm,
but what is really happening is what failure from the government side to address some of these issues. And because of that, people have actually lost that trust in the system.
mm.
Maybe if you come to tell them, I know the government have agreed to do this, they say no, uh, they have done they have done that in the past, and then nothing was done.
Done.
These are some of the challenges that we're having.
All right. Doctor, while we also understand the point you're coming from as the welfare of these doctors need to be paid attention to, like my colleague spoke about, where that leaves the patient or where
Right.
that leaves the common Nigerian. Already before the strike, healthcare sometimes because of funding and what have you has become like unaccessible for the average Nigerian. In fact, I'll share you a personal story. I know of two people during your last strike that passed because of this strike, because they could not access healthcare. So now, while we acknowledge your pains, what do you think that the average Nigerian who might be having health crisis during this period, what do you think that they should do, before this time elapses, in case the government does not, meet your demands as you're expecting?
All right, thank you very much. First, I would like to apologize to all the Nigerians. I know it's not an easy thing. People actually already people are suffering so many things. But the only thing that will plead with them is understanding, and then we really want them to join us in amplifying some of these our demands. We want them to join us in calling the attention of the government to address these issues, to avert this industrial action that is looming. I believe the Nigerians can actually join hands with us to draw the attention of the government so that the strike can be averted.
Okay. Now, from your assessment, since the last time NARD announced this proposed strike, what do you think the body language of the government is like? Have there been any response whatsoever, or has the government contacted NARD?
Well, we're actually expecting some engagements, some meetings before the end of the week,
Okay.
and it is our hope that those meetings will actually yield palpable results, or it will actually change the dynamics of the strike, so that at least uh, a commitment will be extracted from the government,
Okay.
and then our members will see reason why a window should be given, or an extension of the
Ultimatum.
ultimatum should.
Yeah.
So if the government meets if the government meets some of your demands, not all, before the deadline, will not reconsider the strike.
Well, whatever it is that the government is going to do from now till that Monday,
Mm,
yeah, the decision of whether to embark on this to suspend the strike or not lies with the National Executive Council.
okay.
So we have to call for a meeting, discuss this issue with them, we want to decide on the way forward.
Oh no.
The
Doctor,
network
doctor,
has been,
would you take
yeah.
that again, please? Because the network was fluctuating.
Sorry, I said the decision for us to actually suspend the strike lies with the National Executive Council,
Council.
who are the center president, secretaries for each respective center across the entire region.
Okay.
So if there is any updates from the government, any commitment, of course, we're going to call for a meeting, give an update to our NEC members, and then they will be the one to decide on the way forward, because the decision for the strike was done by the NEC members during our last NEC meeting they held at Gombe.
Yeah. Okay.
Okay. Well, now just a general question. What would you hope? What policies do you think? I think we've asked a bit of that, but on a general note, now not just limited to the strike, what policies do you think that the government can implement that will make the healthcare, in Nigeria generally better? Because I'll give a bit of background. We still have budgets for health in Nigeria, way below the declaration that was signed here in Abuja, and way below what other countries, African countries as well, have budgeted for health. What policies do you think the government can change or bring about in the healthcare sector that can help to, ease it a little bit?
Well, for me, I think what you've mentioned, the issue of the budget allocation. If you look at what is being allocated to health, it's far below the standard. If the government can actually increase more funding, look at a way of improving the welfare of all the healthcare workers, and then make health accessible to all the populace, I think it's something that everybody will be happy to have. If you look at the way things are now with the inflation, not everybody can actually afford to go to even the public hospitals. That is the frank truth and the reality. Why can't government have or improve on the national insurance scheme, where people will only pay a dime to get access to their health, while the government supports them with so many other things that will actually that will ensure at least they get all what is needed when anytime they come to the hospital. That is my own personal take.
Okay. All right.
Just to conclude now, just if the president were watching this interview this morning, what is that one reform, one decision that you ask him to take to improve the healthcare sector in Nigeria?
Well, if I'm to have an audience with Mr. President, President Bola Ahmed Tinubu, which I pray that this our interview will actually get to his ears. One most important thing that all health workers have hope on is the issue of that collective bargaining agreement, which I've mentioned earlier.
Okay.
If that CBA will be included, and then the implementation starts with immediate effect, it's something that all health workers have hope that it will increase their salary. That's the only most important thing to all health workers now. People have been asking about when is this CBA going to end? When is the government going to implement all the requests or the demands forwarded by all health unions?
All
All
right.
right.
Thank you
Doctor.
so
It
much.
is one of
Okay. Thank you so much, Dr. Abdul Majid Yahaya, for taking our time to have this conversation with us. We will join you. I mean, you've called us many times to join you on this call to the government. We will join you, in this fight for better treatment for the Nigerian doctors. Thank you so much for joining us on the conversation this morning.
Thank you.
Thank you so much. You will be doing a very good job in amplifying some of our demands. We hope you continue so that at least the strike will not be will be averted. Thank you so much.
Thank you very much. Enjoy the rest of your day.
All right, thank you.
All right. If you have if you have been a part of the program or you're just joining us, we have been talking about the residents doctors threatened strike that will take place on Monday, the 10th of August, 2026. They, on their part, have said that they have understood with the government countless times. But joining us today was Dr. Abdul Majid Yahya Ibrahim, the Publicity Secretary and Social Secretary of NARD. And he has been able to help us understand the grievances of the doctors. What are your thoughts on this, conclusively?
And some of the challenges that the doctors face, they are really concerning. the issue of burnout. He mentioned resident doctors, just about 12,000, even less than 12,000 in the entire nation, Nigeria. And of course, that means that it is not enough. There's a constant brain drain in the health care sector. Again, the basic reason is because these guys are not getting what they're asking for. They're not getting the welfare package, from the government. And these are basic things that they need to have to ensure that we have our doctors here. Again, where Nigerians can afford healthcare more, is within the primary healthcare, and these are where the resident doctors are. And I think it's important that the government pays keen attention to it, and we're hoping that they can actually call the doctors into a room and they can have a conversation, and of course they could find a common ground or have a compromise so that this strike will not happen. But most importantly, whatever promise that is being made by the government, they need to ensure that they fulfill those promises so that we don't find ourselves in this position again where the doctors are threatening to go on strike. You hear them say they've exhausted every means of dialogue. The only thing left for them to do is to threaten strike. And if the government doesn't take the bait, with the threat, they'll we just go ahead and they're going to disrupt, the healthcare system in this country. Now that affects the everyday Nigerian. We don't need that now.
And I mean, the government must try its best to meet up with the financial demands of these organizations. This is the same thing we have been talking about with ASU since 2015. ASU and the federal government have been in this back and forth that seem to come to absolutely no end. We have NLC still in the same back and forth with the government. Now we cannot afford the doctors to do that as well. A worker definitely deserves his wage, and if they're doing their job, they need to be rewarded for it. Because to paint a picture of 12,000 resident doctors, these people will handle emergencies, they will handle childbirth, they will handle operations, they will handle general treatment. It's overwhelming for a person, and we're hoping that while we lend our voices also in activism to the government to listen to the demands of the NARD, they will also pay attention and do the needful. But this is where we will be wrapping it up for this morning on Rapid Done. Thank you so much for being a part. Just to remind you, we are active across social media platforms on Facebook, on Instagram, on Twitter, which is now X, and on TikTok it is at Rapid TV. We have our YouTube page at Official Rapid TV. If you have a link to the government, please copy the link and send to the government so they know directly what the demand of the National Association of Resident Doctors is about. Now, moving on, we have our website, www.rbnradiotv.com, that allows you to connect with us from anywhere in the world. And an addition would be Free TV. We're now on Free TV. Please download the app on iOS or Play Store and search for Rapid TV and get connected to all of our programs nationwide. Thank you so much for joining us on the show this morning. I am Martha Alu.
And I am Victor. Okay, we'll see you tomorrow.